This is Erica Altman. I'm doing my Ivpb. I'm giving Self-Traxone 1 gram Ivpb every 24 hours. I'm giving this medication to Miss Janet Green. And Miss Janet Green does not have any allergies. She last received this medication yesterday at 11:30, and it's 11:30 today, so I'm going to give it now. I'm going to compare my medication to the MAR. This is Self-Traxone 1 gram. Self-Traxone 1 gram. So this is the correct medication. I'm going to make sure that it's the correct dose. And the book says 1 to 2 grams every 24 hours can be given. Also, I'm going to make sure it's diluted correctly. Self-Traxone can be further diluted with D5W, and this is 15 milliliters of D5W. I'm going to make sure the fluids that are hanging in my patient's room is compatible according to the MAR. Miss Green has D5W hanging, and the book says that Self-Traxone is compatible with D5W. The rate of administration is 30 minutes. And also, while I'm thinking about that, I'm giving this medication at a rate of 25 drops per minute or 100 milliliters per hour. Okay? Some precautions that I should take when giving this medication is to watch for symptoms of hypersensitivity reaction, which can include itching, burning, discomfort, chills, fever, or pain at the injection site. To also make sure that the patient stays adequately hydrated and to monitor renal function. Okay. I'm going to go ahead and wash my hands. Come out. And prepare the medication. I'm going to label the medication with the patient's name, which is Miss Janet Green. 1 gram of Self-Traxone. The rate that I'm giving it, 100 milliliters per hour or 25 drops a minute. The time, let's say 11:35. The expiration date. Also, I will check the expiration date of the medicine, and it is July the 16th, 2020. So I'm gonna make sure that I put that on the medicine. And I also check the medicine to make sure that it doesn't have any particles in it. Okay, so I label my medicine. So now I'm going to get ready to prime it. Okay. Got nervous now. Sure. Okay. So now I'm going to get ready to go to my patient's room. Okay. Good morning, Miss Janet. This is Erica Altman. I'm your nurse, and your doctor ordered you Self-Traxone 1 gram IV piggyback. This is an antibiotic to help with the infection that you have. Miss Green, can you tell me your name and your date of birth? Okay. Can you, and she will tell me her name is Miss Janet Green. Her date of birth is 2/20/69. Miss Green, do you have any allergies? And she says no, no known allergies. So I'm gonna go ahead and wash my hands. And also checking again to make sure that the medication is compatible with the fluids hanging, and D5W is compatible with ceftriaxone. Okay. I'm going to lower fluids to check for patency, and I see blood return. And also I'm going to check the site to make sure that it's not infiltrated. I don't see any drainage, it's still intact. And also, Miss Green, this antibiotic can have reactions, so if you feel any pain, any burning, any tingling, or any discomfort, please let me know. Go ahead and lower my fluids. Alright. I'm gonna take an alcohol and I'm gonna clean the hub for 15 seconds. Open. Okay, I'm going to, at this time, I'm going to adjust my fluids. No, not adjust my fluid. Count my drops. Okay, now I'm gonna count for a full minute. Okay. Now at this time, I'm going to clamp this, and I'm going to re-raise my primary fluids to the rate that the doctor previously ordered it. And I'm going to check my patient and make sure that the patient tolerated the procedure well, that they didn't have any complaints, and I'm going to document.